Everyone, and welcome to our show, Causer Docteur, which is sponsored by North Shore Medical Center, located here in Miami, and which is accessible to via I-95. If you live Broward or Dade County, you can reach us, okay? And this show, I am Edlin. I will be your host tonight. And we're going to have a wonderful show, very informative show, for a show that I feel that is gonna be very, very vital for the livelihood and the way that we deal with certain issues. And tonight we're gonna be talking about a topic that is very highly important. We're gonna be talking about breast cancer. And we have with us tonight a wonderful, wonderful surgeon who's gonna be here to basically inform us and teach us regarding this issue, which is big, very big, the issue of dealing with breast cancer. Tonight, we have with us Dr. Håkan Charles Harris, MD. Welcome.
Thank you. Thank you very much for having me.
Of course, we're going to be talking some more regarding the issue. We will be back. Don't leave.
Qui ça North Shore Medical Center veut dire pour vous? North Shore Medical Center, c'est un centre qui avance en pile, qui est certifié pour traiter stroke. Ensemble, avec une équipe qui est là pour avoir bon soin.
Live lady, ma vivre longtemps pour me faire activité avec monde que moi j'aime.
North Shore Medical Center va traitement cancer qui est plus moderne. Il utilise technologie avancée pour traitement thérapie à radiation à une intensité variable qui va monde qui fait cancer plus l'espoir.
Ça veut dire nous avons joué un pile fait.
North Shore Medical Center est spécialisé dans la grossesse qui a un problème. C'est celle l'hôpital dans North Miami, Dade, qui a un département pour bailler bébé soins intensifs.
Live Lady plus fait avec petite fille.
Nous dépensons plus passer 35 millions de dollars pour acheter nouveaux équipements et technologies pour bailler monde dans la communauté en plus bon soin. Dès nous venons dans North Shore Medical Center, depuis nous connaissons c'est là pour nous toujours aller.
Welcome back. My name is Edlin Torshin, and you are watching Causer Docteur, show sponsored by North Shore Medical Center. And don't forget that North Shore Medical Center offers free screenings every month, and they do have a wonderful neonatal intensive care unit, which take care of the tiniest babies. And if you are having complications with pregnancy, they can also help you. And very recently, North Shore has become a certified primary stroke center, and they offer as well the latest option treatment concerning cancer. Once again, welcome back, Dr. Charles Harris, MD. You've been in the staff of North Shore Medical Center since 2000, correct?
Since year 2000, correct.
And you are also board certified by the American Board of Surgery and also Vascular Medicine, is it?
Correct, correct.
You've graduated from medical, you got your degree from the West Indies, University of the West Indies, of course, which is very close to home, okay?
We're neighbors.
Yes, we are. You had done your internship and also your residency at Mount Sinai Hospital, School of Medicine?
In New York City.
In New York. And you also have, you were also the chairman, correct, of the Department of Surgery from 2000 to until how long you were the chairman?
2003 to 2009.
Okay.
So a total of 6 years.
And Vice Chief of Staff at North Shore Medical Center as well, correct? From 2009 to 2011?
Correct.
Okay. Anything else that you would like for the audience to know about you before we start?
Well, I've always taken an interest in the community here in North Miami, and over the 11 years that I've been here in practice, I've come to know so many members of the community and take care of a lot of patients here. So I feel like this is my home, and my purpose here is to try to educate and to help as much as I can.
Okay. Dr. Charles Harris, let's just start by letting the audience know, what is breast cancer?
Breast cancer is a disease of the breast, obviously, and some of the normal cells in the breast become abnormal, and they grow and take over the space of the normal cells, and over time it can grow into large lumps, and it can spread to different areas. So it's considered to be a malignancy.
Okay. And what are the biggest risk factors as per for someone not to be exposed? Is there anything that causes breast cancer?
Well, the biggest factor is age. The older you get as a man or as a woman, the chance for getting breast cancer increases. As a matter of fact, 1 in 7 women in their lifetime will have breast cancer. So out of every 7 women, 1 woman will have breast cancer.
I hear you mentioning men and women.
Yes, absolutely.
I believe a lot of people are under the same impression that only women have to deal with this type of cancer.
Well, the breast is a part of the body that both men and women have. It's just that women's breasts are much bigger than men's breasts. So the bigger the breast, the more chance of having breast cancer. So it's a type of percentage game, and also it's a hormone game as well. Women have female hormones which tend to stimulate the breast, which men don't have. So that also decreases the incidence. But out of every 100 cases of breast cancer, 1 case is a man. So 1 out of every 100 cases of breast cancer is in a man.
And when should a woman start getting mammograms or ultrasounds?
It depends on your risk factors, really. You have the risk factor of age, as I mentioned, but if you have other risk factors such as the breast cancer gene, or if you have a strong family history of breast cancer, then you should start screening earlier. The normal age for screening, if you have no risk factors at all, is the age of 40. But if you do have risk factors, depending on the strength of the risk factors, you can screen a decade or even 2 decades earlier.
Are mammograms and ultrasound the only way for a patient to detect that something is wrong with their breast?
No, we would start with breast self-examination. Every woman and man should examine their breast on a regular basis. The recommendation is to do it at the same time every month in the same position. For instance, before you go to bed, you can examine your breast, or when you take a shower, you can examine your breast, and you examine it in the same way. You press the flat of your hand against the breast, and you move in a circular motion against the rib cage, and you can sort of feel if there's a small ball or mass that's there. If you feel anything that you didn't feel the last time you checked, then you go to the doctor.
And does that have anything to do? Is it better for a woman to have a self-breast examination during ovulation time, or doesn't make any difference really?
It makes a little bit of a difference in that during just before the period, the breasts tend to become engorged, more swollen, more full of fluid, also more tender in a lot of women. So that is not the time when a woman wants to examine her breast. Usually a few days after the menstruation is finished, when the engorgement of the breast is a little bit less, then the examination is easier, and the swelling has gone on a little bit, so it's easier to feel any abnormalities at that time. So that's the recommendation.
If a woman feels that their breast before, especially before their menstruation, that it's swollen, do they have to have certain concern about it, or?
If it's swollen each time before the menstruation, not at all. It tends to be normal to some degree that you have some swelling of the breast. If it's a general swelling with both breasts and it happens every month, that's not really of concern.
Okay. Can you explain to us the different type of treatment if someone is dealing with breast cancer? What do you do when you see that patient and that diagnosis is, okay, they are dealing with breast cancer? How do you proceed?
Well, once you have done the mammogram, if there's an abnormality on the mammogram, sometimes you do an additional, more detailed mammogram. Sometimes you will do an ultrasound, sometimes even an MRI. After you have determined that you need to do a biopsy, then there are different types of biopsy. Usually what I do is a minimally invasive biopsy using the ultrasound guidance and a small biopsy device that doesn't leave a scar and is virtually pain-free. We do it under local anesthetic. And it's an outpatient procedure. You can actually do it in the office, or you can do it in the X-ray department or an outpatient center.
And not to cut you off, it just came to mind, does the biopsy determine what type of, is it malignant, benign? Is that what the biopsy for?
Yes, the biopsy is for determining whether it is a cancerous or otherwise known as a malignant lesion, or if it's benign. 8 out of every 10 biopsies that I do, and that is done generally, turns out to be benign. It's not cancerous. So we do many, many more biopsies than what we find cancer in. But we usually do the biopsy when there's suspicion enough that we need to check it, the tissue itself. And the biopsy specimen that we get, we send it to the pathology lab, and in the pathology lab look at it under the microscope to look for the features of malignancy.
And if found malignant, correct, is when you determine, okay, you're going to have to deal with this. They're not just going to remove it. It's something more serious.
Yes.
What do you do?
Yes, the benefit of doing a minimally invasive biopsy is to get a diagnosis of cancer or breast cancer or malignancy. Once you know that, then you can discuss with the person the different options that you have of surgery. Usually the options would include the traditional mastectomy, which is what everybody is afraid of. Yes, it's taken off the breast. It is still considered to be the gold standard because we look at how long does somebody, how does somebody survive, how well do you live without any disease. So when you remove the breast, you tend to have a very long survival. But of course we have modern techniques now that we use most of the time where we preserve the breast. And this is known as breast conserving surgery.
Okay, and you just remove the part of the breast that got, okay. And what about chemotherapy? How does that get into the treatment that you're gonna have your patient follow?
And generally, chemotherapy, which is usually intravenous medication that is given once every 2 weeks or once every 3 weeks, that is given for 2 reasons. Breast cancer has spread already, or breast cancer that we determine to be likely to spread. So we want to hit it before it spreads. So depending on what we find when we take the lump out, the size of the lump, how aggressive the characteristics are, if it has already spread to the lymph nodes under the arm, because we also check those, and if it has spread further than that. So depending on all of those factors, we give what is known as a stage. And breast cancer has stage 1 to stage 4. If you have a stage 1 breast cancer, then it's early.
So it's most likely to be treated?
Without chemo, if it's stage 1. Yes.
Okay. How do you, as a surgeon, give this type of news to a patient? Do you kind of prepare them mentally if they, you find out that they are now on the 4th stage of breast cancer?
It is one of the most difficult things that I have to do. Telling a person that they have cancer is never an easy thing. And as you can imagine, everybody's different. And I might tell one person, and